Thanks. Our industry loves to have data that we can measure. We want to have metrics, and trust is like hope and belief, and it's really hard to tackle that. So, how do you build trust within these communities?
To Dr. Matthews' point, building those relationships within the community are key. And at Clinispan Health, the two main ways that we go about doing that are partnering with organizations who already have that connection in those communities, and then also working with individuals in the community who have good relationships with the people that they are, working with and around, in order to be able to further educate them on what's going on, to then hopefully, get them enrolled in a trial and just to give them a better general understanding of what clinical research is and how it affects them.
What do you think that the industry as a whole, clinical research, pharmaceutical, medical, the industry collective, what can we do to change? What can we do to take that first step to initiate change in the right direction? Um, Dr. Matthews, do you want to go first on this one?
I'll let Rashad go since he looked like he had some response.
Oh,
He was ready to go.
I can
we're
definitely,
all ears, Rashad.
I can definitely hit on that one. I would say one of the first things that needs to happen is the inclusion of people of color in the research process, not only as participants, but also as administrators and facilitators. We need more Black doctors in the spaces because, Black people trust Black doctors. Like, let's just keep it 100. People of color trust the people who look like them, who provide care to the people that are in their communities. So I think that is one of the major things, making sure that, we hire people of color to facilitate and participate in these trials. Also, making sure that, the doctors are also participating in the trials. That's one of the big things that I'm a proponent of as a student doctor at New York, is making sure that I'm actually involved in the research process so that when I go talk to participants, I can tell them about what it was like and my personal experiences with it. And it's not such, gray areas or, guessing surrounding, the process and what goes on. So yeah, I think those are two major things that we can do immediately to help facilitate more diversity and inclusion within the clinical research space for sure.